All right, welcome in, guys. If you're new here, my name is Dr. Matt. I'm one of the most experienced MCAT tutors and med school admissions coaches in the country. Just going to be on for a few minutes today, so drop those questions here in the comments. Drop your MCAT and med school admissions questions here, or reach out at www.mcatboss.com for personal guidance. Awesome. How is everybody doing? All right, so let me see here. So we need to do a couple of quick checks, see where everybody is in the app cycle, see who is getting interview invitations, who's getting secondaries and filling them out. Hopefully you guys are having the kind of response from schools that you are looking for. Do a real quick clip here. How many medical schools should you apply to? So I get this question every time that application season rolls around, and I would say for most students, it's probably a little bit presumptuous if you don't apply to at least like a dozen. Now, you could totally go through all the work of being a pre-med and doing your volunteering hours and taking the MCAT and doing your prerequisites and then just apply to like 2 or 3 schools. And if you completely knock out your personal statement, your MCAT and your GPA and your volunteering and research hours, then you might be able to nail it. But for most people, it's going to be a smart idea to apply to at least a dozen. Some students apply to a couple dozen, and I've had a handful of students who've applied to over 30 schools this year. So keep in mind, try to aim for those mid 50 percentiles on your score range. Add a few reach schools in there, add a few quote unquote safety schools, and spread the word that you're applying to medical school. All right. Let me get that exported and we'll get that as a post. But guys, honestly, if you're applying to fewer than a dozen schools, you know, if you're just like a boss and you scored really crazy good scores, there's nothing wrong with just doing a few. SKFM asks, do you recommend DO for your students? I will be honest with you, I do recommend DO. I think DO is awesome. I have a ton of colleagues who I've worked with in the hospital who are DOs, and they're just the ones that I have worked with are super awesome doctors. They have solid training. They know what they're doing. Their patients love them. And yeah, a lot of times the admission stats are just way more reasonable for DO than they are for MD. So yeah, DO's awesome. Nader says, what are a competitive amount of clinical hours? You know, the general gist is that it needs to be kind of like low to mid hundreds of hours. You don't need to have like 10,000 hours. You know, you're going to run into people who have had like some kind of like a clinical job or a clinical career, and they're just like maxed out at like some crazy number of clinical hours. But like, yeah, you don't need to do anything crazy. Welcome in on the YouTube side. Yeah, you don't need to do anything absolutely crazy. SKSK says, I don't like how you have to take way more tests for DO. Yeah, I mean, that's kind of the, I think that's a reasonable, I do think that is a reasonable thing to keep in mind. Having trouble with my mic stand here today. I do think that is a reasonable thing to keep in mind, is if you end up going the DO route. Come on, mic stand. There we go. There we go. So yeah, if you do end up going the DO route, do keep in mind that you might end up taking more. You might end up taking more exams than MD. So you may get you may be lucky enough to get the you might be lucky enough to get the entrance stats that you want more than with the MD, but it's a trade-off. Mike says, are you in residency? So I work in neurodegenerative disease. I am part of a research venture where we're trying to cure Alzheimer's. Nader says is a 3.7 science, 3.8 overall, more of an MD or DO applicant stat. I mean, I got into med school with a 3.8 into almost every MD program that I applied to. So I don't think that's a bad number at all. 12D Sun says my GPA is 3.7. Science GPA is 3.45. Do I need to do a post-bac? I have a 517 MCAT. You know what? I'm going to record my response to this because this is just such a good question. All right. So I just got asked, my GPA is a 3.7, but my science GPA is a 3.45. Do I need to do a post-bac? I have a 517 MCAT. And the answer is no. You do not need to do a post-bac. Those are great numbers. You need to make sure you do a really great essay, a really great app, and have strong hours. But those are totally fine numbers. The MCAT is stellar and it proves that you're competent in science. I cannot imagine doing a post-bac with numbers like this. Please do not waste a bunch of time. Do not waste a year or two of your life on a post-bac. Go get into med school and become a doctor. You got this. Yeah, that's just, you don't worry about that, man. That's great. Mike says, lucky for both, but depends on extracurriculars and MCAT. Yes, good for both. Yep. SK says, do you think we cure? Yeah, sure thing, man. Do you think we cure Alzheimer's anytime soon? So my answer to this is probably a lot different than a lot of people work in it. There's this very broad understanding that Alzheimer's and dementia are really complicated diseases. And that part is true, right? The part is definitely true. Alzheimer's and dementia are complicated. They're multifactorial, all this stuff. The difference, so the approach that we take with the group that I'm in, the approach that we take, and we think we're going to be the first in the world to do this, is we think that Alzheimer's is a disease actually caused by a depletion in really important neuropeptides. We think that it results in a number of other side effects, and a lot of the medications that have been under development treat the side effects of that depletion rather than addressing it. So we hopefully are going to be closer than anybody else to preventing it and doing repletion neuropeptides to try to cure it. Muzz says MD acceptance with a 507, and Muzz genuinely have had lots of students get in with a 507. Just apply super broadly. Make sure you have somebody look at your app, make sure that your personal statement is on point. Make sure that you're talking about the things you need to talk about, avoiding talking about things that you need to avoid, rewording the things that you need to reword, and do a pretty broad application, because my main concern, and I'll be straight with you, the numbers on the score breakdown that you mentioned, the numbers on the score breakdown are concerning for the cars section. So you guys know I have been tutoring the MCAT for over 13 years. I should leave this here in the thing here, mcatboss.com. But yeah, the 507 is not a concern. The fact that the lower one is the cars section, that is going to be the biggest concern for medical schools. And you really got to apply broadly. You probably more than any other sort of scenario or applicant, you really want to make sure that your personal statement is remarkably well written, because once that cars section is kind of like under the 125 mark, I would say is when it feels like a danger zone in terms of how the school views the reading comprehension. It's super, super important. SKSKFM says, why is car scene is so important? Yeah, there's a couple things here. The content of the rest of the MCAT doesn't matter that much for medical school. And it is as messed up as that may seem, because I know you guys, like, we all study really hard for the MCAT, but the majority of the MCAT, the content's just not like make or break. Braden says cars means nothing once you're medical school. That is completely profoundly false. That's just completely false. Cars is the most important section for med school, hands down, no exceptions. When you get into medical school, you will need to know next to zero of the actual physics that you need to know for the MCAT. Like, you're not going to be asked about friction of a car going down a ramp. You're not going to be asked about like the Bernoulli equation. You're not going to have to do like a ton of general chemistry. Like, there's a little bit of chemistry that at least we hint at when we talk about physiology. There's the biology that's on the MCAT is fundamental to the stuff you learn in med school, but like, you'll refresh that biology when you're in med school. The car section though is a section where your ability to score really high frequently reflects your ability to read fast and understand what the main idea is. So I tell students, so cars is one of my 100th percentile scores. It's one of the ones that I love talking about the car section. It's such a cool section. It's totally a doable section if you know what you're doing and you're used to the test writer's tricks and you read fast. So I love training people on cars, but cars is a section where doing well often requires you to read at a rate of like 300 words per minute. And I've tested this extensively for like over a decade, right? Like, I've written MCAT curriculum, I've written practice exams and exam explanations. Braden says, I'd argue the test taking strategies that align with doing well on the sciences is closer to what allows you to be successful in med school. So Braden, I'm not sure what stage of your, like, if you're already a doctor, if you've already passed all your board exams, or if you're a pre-med, I don't know where you are in your education, but part of what you're saying is definitely true for step one. So Braden is absolutely right about the sciences and doing well on the science exams, helping you on step one. If you guys are like, yo, what's going to make me good at step one, then getting good at the science sections on the MCAT is essentially the same thing that you're going to need to do well on step one. Now, for step two though, you're going to be reading for like 9 hours to do boards on step two. So think about that for a second. If you can read 300 words per minute and do well on the cars section, your ability to pass step two boards is going to be way higher than if you're stuck and you can't do cars very well. So the big thing you have to think about for cars is, if you do well on your science sections, they're going to be like, dude, this guy is going to ace step one. If you do, Emma says, I think the research shows the best correlation for BB. Yeah, as far as I understand, I believe that the biochem probably is the best predictor. I'm guessing it's the best predictor for step one, and the cars, I believe, is the best predictor for step two. Step two, man, it is literally like you are power reading hundreds of pages for 9 hours. And then you have to really quickly have these like takeaways from what you read. Now, mind you, step two, of course, is like, it's like medical vignettes and stuff. So it's not like philosophy and reading about, Plato and Aristotle and other stuff, the way that the cars exam is like all over the map with the topics. All right. Real quick. So Nader says, with my 3.71 and 3.8, can I be confident with applying to most MD schools rather than DO? Yeah, dude, those are just not like low scores. Those are totally fine. So I don't know exactly. I don't remember what my like science GPA was, but my overall GPA was 3.82. I got interview invites at almost every single school that I applied to. I got multiple acceptances and scholarship offers and stuff. So you should be fine. Those are not bad numbers, man. Let me see, where were we? Okay. Next one says, I'm in my late 30s now, starting now from the MCAT too late. I'm going to do it another life. I'm always, going to say I'm super supportive of people who are like mid-career changers and changing things up and taking the MCAT, going into med school and making it happen when they're non-traditionals. So I graduated med school at almost 40. I think it's great. I don't think anybody should be like, shoot, it's too late for me. By all means, like if that's what you want to do, jump on it, but do your best, put your best foot forward, give yourself enough time to study for the MCAT so you can, ace your way into school and welcome. All right. Evan says, how long does it typically take to get your score? My exam was 2 weeks ago. It usually only takes a few. They've been pretty fast about it from what my students this year have told me. So I would expect you to have it back within, I don't know, maybe 10 days or something. Braden says 126 car score who got 99th percentile for step 2. You learn to read better in med school. Props. That is awesome. Unfortunately, not everybody does learn to read better in med school, especially for a lot of students who do almost no reading in med school. I did a lot of reading in med school. I did a ton of reading because I ended up doing a distinction in research. But yeah, no, I know plenty of people who do very little to no reading in med school. So unfortunately, that is awesome that worked out for you, man. Not everybody does it. Roommate got a 277 on step 2 with a 124 cars. Needless to say, only got into one MD school. Yeah, I think so. So I do have, at Muzz, just to be clear, I do have students who've gone through application prep stuff with me because they were trying to kind of like make sure that they were padding their bases on like applying with a 124. I had a guy who just, told me a couple, not a couple cycles ago, I guess it was last cycle that he got in. He applied to, I think he said 34 schools, and he applied with a 124 on his cars. And dude, it was rough, man. Like he spent so much money, but he just he didn't like the MCAT. He didn't want to take it again. So he rolled with it. And, it was hard. SKSK said, do you like UWorld? Yeah, UWorld cars. I think they're good. It's not necessarily identical to AAMC, but it's close enough to get a lot of the tricks that they use. It's useful, right? It's better than nothing. As Stacy says, woodworking as a med lab tech classify as clinical work. So technically speaking, depending, there's a little bit of debate if it doesn't involve any kind of patient contact. That's kind of the main follow-up question I have about that. SKSK says, you wouldn't say interpretation of the biochem passage is very important in comparison to cars. Yeah. No, that is important for understanding like how we test like comprehension on passage-based stuff. So that is important for step 1. It's just the biggest thing, and I can almost guarantee you that what Braden was saying earlier about like doing really well on step 2, I can almost guarantee you that he either learned some really powerful skim reading or that he had a crazy high reading speed by the time he got to step 2. And there are definitely some people who pick that up during med school, and it's awesome, man. Frank says difference between MCAT and GRE. Oh, dude, that's just those are completely different tests. Like GRE is just, GRE is genuinely a very general exam, and the MCAT is like hyper specific about a ton of science topics. So if you want a quick, Frank, if you want a quick way to kind of see the difference, Google what's on the MCAT PDF, and there's a free double AMC guide to the topic list on the MCAT. It is about 110 pages long of like microscopic print in bullet points, and you have to know essentially all of that to do well. So like it is no joke. Thank you guys for helping us get over 300 likes. I appreciate it. Make sure to check out mcatboss.com if you're looking for personal help. If you're new here, my name is Dr. Matt, and I am one of the most experienced MCAT tutors and med school admission coaches in the country. So drop those questions here. We're going to be on just about 4 or 5 more minutes, guys. So drop those questions. Muzz says, depends on school, to be honest, value shadowing. Yeah, I think the only thing I would add to that is just you want to have some clinical experience. Shadowing is still considered valuable. I would be hesitant to send a student in applying without doing some shadowing. So try to at least have like, I don't know, do like 30 hours of shadowing in an emergency room, and like 30 or 40 hours of shadowing in like a general clinic, and 20 or 30 hours of shadowing in a, in some kind of a specialty, and try to go in with at least some kind of triple digit number on all of those categories if you can. 519 MCAT was scoring 522 on practice, worth retaking for high end of tier 1 MD schools. Okay. So, man, I'm there's like 100 questions I have for you for follow-up before I could tell you whether I would say yes or no. Again, feel free to drop me a line if you need, to pop on a session and talk more details, but it really depends. The main thing with those like upper percentile scores, right, is like once you crack that like 85th percentile mark, getting the last few percentile sort of rungs closer to 100th percentile is super hard, right? Like diminishing return. So I have some tips I can tell you to like kind of like spot check for weaknesses and stuff. But it's super work intensive. So like, honestly, even if I have a student who tells me they're only trying to add 3 points, if they're trying to add 3 points on the upper end, I put them through about a 3 to 4 month plan to actually get to try to like land those like upper 520. So I'm just being real straight with you. You can jump on a session with me if you want to kind of talk about more details, but like, dude, 519 to 522 is not a joke, right? Everything kind of has to line up. All right. Frank says, I asked because I'm in school to become a CAA, and I'm just unsure which to take. I'm sorry. I'm not sure what the question is there. If you're, are you talking about like being a CNA, CRNA? Just I don't know. Maybe ask a follow up. I'm not sure what you're going for there. Evan says, how much does it affect my application if I have low volunteer hours? So when it comes to volunteer hours for non-clinical activity, there is a huge amount of debate over how much they're supposed to be, right? So like some students are like, I just want to do like 2 hours a week in a soup kitchen for my sophomore year and then put that 100 hours down. And then other people are like, oh no, I did like 3,000 hours of volunteering with like a, Big Brother League or something like that, right? So it's all over the place. Liliana says, as a receptionist at a clinic, good job if the doctor's there, let you shout at them. I honestly don't think that like, and maybe somebody can point out if I'm wrong. I don't think that actually, that the admin side is categorized as like actual medical job. I could be wrong, but it usually has to involve some kind of like, sort of like medical care of the patient, and that's more like, I guess, sort of like billing size. Next question says, how expensive are your services? So students spend anywhere from the mid like 200s down into the 100s depending per hour, depending on how much they work with me. I do offer like group rates. I think more you guys need to like reach out to each other, because I actually do let up to like 3 students split a session if they do decide to. So if you're like super looking to like jump on and save money also, that tends to be more useful for like the MCAT tutoring side, and obviously not super helpful for that's not something you'd probably want to do if you're trying to do like a individual app review. Then you really just want to like jump on just a session. Now compared to redoing an entire app cycle, it's like super not expensive at all. And compared to like the big companies like Kaplan and stuff, man, I have a bunch of people who came to me this year after dropping like 20-30G with the big 3 MCAT companies, and they're like, dang, I wish I had found you earlier. So, let me know if I can help you guys out. It is top of the hour. I'm going to stay on like probably 2 or 3 more minutes just in case anybody else has questions. Otherwise, drop me line at mcatboss.com. If you have a question, I will be on here like 2 more minutes. Drop those questions here. Thank you guys for following. Speedy says, is there an easy med school? So, man. So this is such a good question, and also like a complicated question to ask. The simple answer is no. If you get into med school, by definition, it's med school. It's going to be a hard school, because all the med schools, like all the legitimate actual med schools, have to prepare you to take boards, right? And so if they're preparing you to take boards, like it's not easy, right? Like it's medical board exams. Like they're like full day, 8 to 11 hour exams. Like it's going to be, if it's a med school, it's going to be hard, right? Now there are schools that are easier to get into, right? Like DO schools are easier to get into, but you still end up taking boards. Oftentimes you end up taking double boards. And so that is still really hard. Now, the easiest ones to get into in terms of preparing are to actually get into a European medical school, because they do not require the MCAT at all. Now, the challenge there is, students come out of like high school, and then they're getting into med school straight out of high school, and it's technically like 2 years of college, and then it's 4 years of med school, and then a lot of times your hospital rotations are in a bunch of languages. So I mean, there's trade-offs all around, but yeah, it's not like it's not a walk in the park, right? All right, guys. I'll stand for like 1 more minute. Any other questions that come in? Remember, you can drop a line at mcatboss.com, or you can reach out and you can actually email me directly, Matt at mcatboss.com. Speedy says, trying to match into residency in the US after Europe graduation is a nightmare. Yeah. Not gonna lie. Coming back as an IMG for students who did take that route is definitely its own set of hurdles. So, it really truly is like a trade-off, right?